Lesson 1. Effective Communication in Health and Social Care. Welcome to the foundation of care, communication. In health and social care, the communication cycle begins when ideas occur. The message is encoded and sent, then received and decoded, finishing with feedback returning to the sender to check understanding. We use 4 main forms of communication: verbal, nonverbal, written, and augmentative or alternative communication, known as AAC. AAC includes methods like sign language, Makaton keyword signing, picture cards like PECs, Braille, and electronic devices to support those with limited speech. When talking with a service user, face-to-face communication is ideal. It allows you to observe nonverbal cues and immediately confirm understanding, acting as two-way communication. Other two-way examples are telephone conversations and counseling. In contrast, one-way communication includes prescriptions or hospital records. To show you are actively listening, use an open posture, appropriate eye contact, and an attentive facial expression. Your basic verbal skills during a one-to-one interaction should include greeting, probing, checking for understanding, summarization, and termination. However, you must watch out for barriers like jargon, environmental noise, or differing cultural language needs. These can cause misunderstanding, mistakes, confusion, frustration, or offense. If a person has a hearing impairment, you can overcome this barrier by using their preferred methods, such as facing them, speaking clearly, writing notes, or using a hearing loop. Lesson 2. Human Growth and the PIES Framework. Understanding human development is crucial for assessing service users across different life stages. The SCE syllabus divides life stages into 5 age bands. We begin with infancy from 0 to 3 years, followed by childhood from 4 to 10, adolescence from 11 to 18, adulthood from 19 to 65, and finally old age from 65 onwards. Each life stage has specific developmental focuses. For example, during adolescence, care workers must understand the relevance of puberty, self-esteem, peer pressure, and risk-taking behaviors like drugs and alcohol. Across all these stages, development is measured using the PIES framework: physical, intellectual, emotional, and social needs. Physical needs include a balanced diet, exercise, warmth, safety, and rest. When meeting physical care needs, you must also consider infection control measures, like hand washing, wearing gloves and aprons, and not sharing personal items like towels. Intellectual needs focus on communication, learning, problem-solving, creativity, and exploration. Emotional needs involve love, security, and feeling valued. If unmet, individuals can suffer from attachment problems, frustration, or low self-esteem. Finally, social needs require interaction with family and friends and participation in activities. Major life events, such as the bereavement of a partner, are highly impactful because they can affect all 4 PIES areas simultaneously, altering physical health, thinking, emotions, and social networks. Lesson 3. Health, Wellbeing, and Care Planning. How do we properly define health? According to the World Health Organization definition used in your syllabus, well-being is a holistic state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. An individual's health is influenced by several life factors. These are grouped into socioeconomic factors like class, employment, and housing, physical factors like genetics, disability, and age, lifestyle factors, and health factors, such as infections, injuries, or chronic disorders. Lifestyle factors specifically include things like smoking, poor diet, lack of exercise, stress, and substance misuse. Conversely, a healthy lifestyle requires physical fitness, a balanced diet, intellectual stimulation, alongside emotional and social well-being. Major life events like redundancy, divorce, retirement, or serious injuries can positively or negatively influence this well-being. Be aware that the media can present a false or incomplete image of life, which might shape unrealistic expectations about health and life events. Before writing a care plan, you must assess a person's health and well-being. Assessment is the foundation of a personalized plan because it identifies unmet needs and helps you plan interventions. Goals within a health plan must follow the SMART acronym: specific, measurable, achievable, realistic, and time-related. For instance, a short-term SMART goal for an inactive adult could be to walk for 15 minutes on 5 days this week and record it in a diary. This perfectly meets the criteria for effective care planning. Lesson 4. Body systems and vital signs. To provide effective health and social care, you need a basic understanding of human anatomy and vital signs. The human body is highly organized. Its hierarchical sequence starts with cells, which form tissues, which then form organs, and these organs work together in organ systems. The SEC syllabus highlights 6 main systems: cardiovascular, respiratory, digestive, renal, musculoskeletal, and nervous systems. These systems do not function in isolation. An individual's overall health depends on them working together as a whole. For example, the respiratory system uses the lungs for gas exchange, removing carbon dioxide and oxygenating blood, which the heart then pumps around the body to the cells. In the digestive system, the intestines are responsible for the absorption of nutrients from digested food, while the pancreas produces hormones to regulate blood sugar levels. The renal system relies on the kidneys to remove waste products and regulate body fluid levels. Finally, the nervous system, using the brain and nerves, manages thought, coordination, and the control of body responses. In care practice, we monitor these systems by checking the 4 main vital signs: body temperature, pulse, breathing rate, and blood pressure. For a resting adult, the expected pulse rate in the syllabus is between 60 and 100 beats per minute. By monitoring these signs, care workers ensure the body's interrelated systems are functioning correctly. Thanks for watching. For free practice questions, study guides, and flashcards, visit exampreprise.com. Good luck on your exam!